So thank you, Kate, for such a thorough overview of what CQC has been seeing through the last 16 weeks, but also about your future thinking and that great offer for us all to be involved in terms of getting the sort of approach that will be most effective going forward in the future. And I know that we really appreciate that offer. So thank you very much. If I move on now to Aileen, who's a director at the National Audit Office, and you're going to be talking to us about what you've seen in terms of your review over the life of the pandemic. So we're in your hands.
Thanks very much, Julie. Just waiting for colleagues to unmute me. So what I wanted to talk about today was NAO perspective, what we know already about the way that adult social care, and in particular for it, has responded to the pandemic. And I think, following on from Kate, I think I wanted to say up front that this has been the most extraordinary period of provision of public services that I've seen in the 35 years I've been in the NAO. And I think that the extent of the government's response and the spend has been, the only word you can use for it is extraordinary. So the question is, what do we know about what happened? What we be doing in the future, and what can we draw out so far? So I'm going to attempt to answer some of those questions. Next slide, please. Some questions that the panel was set was, what is COVID-19 the state of the adult social care? And I would totally agree with what Kate has said. I think it's shown up very sharply a lot of the problems that we knew already. And then the question about how do we ensure service continuity and quality? And that really goes to the question of resilience, both at a national and local level. And then lastly, how do we reshape markets to deliver high quality care and value the workforce? So what I'm going to do is start with what we know already. If colleagues could move the slides on, that would be really handy. Now, the first you guys have seen this slide before, but I apologise for showing it again. I think that one of the salient features about this pandemic is it hasn't happened to a local government sector and an adult social care sector that was in tremendously good health. The local government has been financially stretched for a decade, as we have shown in report after report. That central red line there shows you the decline in council spending power from 2010-11 through to 1920. And the underlying stability as we laid out in a report on financial sustainability in 2018 is weakening. So council's financial resilience was weakening. The proportion of adult social care was rising. I mean, it was becoming increasingly difficult for them to make savings every year, because remember, the reductions were year on year on year. So it wasn't one lot at the beginning, that was your lot, and another in 2015. It was year on year. And lastly, the demographics have been against us as well over this period. You know, the population is ageing. The population of 18 to 60 who need care has been rising, and there have been other pressures such as quite a spike in homelessness. The Homelessness Reduction Act was passed. We've got less money and we've got more things to do with it. And one last thing about the local government finance system. I know I kind of go on about this, but I think it's really important. Its components are changing. So that top line there shows you the increasing rise, the increasing importance of council tax within the system, so that the pressures that are on council at the moment, with people losing jobs, being made redundant, furloughed, not being able to pay their council tax, is really important. The same goes for business rates. So we've got a financial system that's under pressure and has been for 10 years, and it was into that we then had to cope with the pandemic. So next slide, please. So what I'm going on to talk about now is the report that Kate referred to. It's called Readying the NHS and Adult Social Care for the COVID-19 Pandemic. And it's a factual overview of what happened mid-March and mid-April, starting with the letter from the Chief Executive to the NHS on the 17th of March, and then the social care parts of that, and then what happened against the Social Care Action Plan came along on the 15th of April. So the report doesn't draw any VFM conclusions, it just tells you what the story is so far. Also what's important from any perspective is that we didn't just concentrate the NHS. We actually made sure to cover adult social care as well. As you guys know better than I do, parity of esteem question is still hanging. So we have, what do we know? Well, what we know is almost immediately, resources of 3.2 billion were provided for authorities. The first lot on the adult social care formula, but also service pressures in 2 billion. So I think the salient fact that this tells you the fact that the system didn't have enough money in it to be able to cope with the surge of demand. And then we had the 100 million later on for infection control. So there was more money straight away up front. Now, I'll talk about it again in a minute, but how that money is provided was also important, and what the other aims that it was supposed to satisfy. Yes, the increased capacity of work, and they discharged patients, and that meant that the NHS was never overwhelmed at the national peak of the outbreak, because what the NHS was doing was it was for the reasonable worst case scenario under the modelling, but without a lockdown. So when the lockdown happened and the patients fell, that meant that the NHS was never overwhelmed. And if you look in the report, that bed occupancy with respiratory support reached 50%, so it was never more than that. Now, that mentions were discharged between mid-March and mid-April, and what we know is at that point government policy was not to test everyone for COVID before they went elsewhere, and so we don't know at that point any people with the virus, and we don't know where they went and what effect they had, in the sense that we don't know at a national level. Testing for health and social care workers has been a challenge. Again, not enough at the beginning, and a slow ramp up testing capacity, with social care workers always added in behind NHS staff. So if you look at dates which testing was announced for different sections of social care, it was always behind everybody else. And then going on to PPE, another issue. We looked at the central procurement, because obviously it's what was happening locally. Central procurement met the modelled PPE requirement. Again, that's against the worst case scenario, reasonable worst case scenario for some items to the NHS, but then half. And for social care providers, central procurement addressed a small proportion of the requirement. So we would much have preferred to be able to measure demand level was. So how were we doing against the demand for PPE? But we didn't have that information, so we went with modelled PPE requirement. So what all this means is that as a nation, we did a job with beds, respiratory support, and what we did a less good job on was testing and PPE. So those are the two things where it needs to be action before we think about another spike or what's going to happen this winter. Next slide, please. Now, in terms of the effect, particularly on adult social, as Kate has already referred to, data was a big problem the way. So the Department of Health put in the capacity tracker. Now, what that was occupancy 80 to 90%. That does mean that is lower than before. So looking forward, CQ said a further increase in spare capacity could mean less income for providers short term. Now that gives us market issues going forward. There's also a decrease in hours and rising costs for PPE, rising workforce costs for domiciliary care providers. So there are those. So resilience is a really big issue. And all provider organisations are warning of significant and rising costs with extra PPE as a real threat to financial stability. Recovery, at the point we did the report, CQC were saying 18 months. And again, this point about reduced resilience to future. So as well as making sure that the system we have works better, we've also got to think about how much we want in terms of resilience against future, what we might call black swan events. Next slide, please. So I just wanted to draw... Oops. Excuse me, can I have the next slide after that? Apologies, I think I've probably forgot to say next slide a minute ago. Okay, that's great, thank you. So this graph shows you from the report what actually care homes. And you can see at the peak of the pandemic, there were 1,009 care homes. So about 40% of all of them had had an out, and that died away again. So that's what we know about outbreaks in care homes. And if you look in the report, again, we map week by week and where they happened, and you can see a similar. So next slide, please. So this next graph shows you about what happened with the two tranches, the 3.2 billion about that came in tranches of 1.6. So there was more money both for the NHS and adult social care. But the important point about the 2 billion, it's not baselined. So that means finance directors are really cautious about how much they want to, how much they'll spend it, for instance, in the amount that they're paying providers, thinking about what our exit strategy from this is, and the fact that we don't know what the quantum is for local government until the spend happens over. The other point about the money, it was spread across all service pressure. You look at the letters that went from the Secretary of State to the select committees, HG and the PAC, the number of services that were listed for money were quite considerable. And how much money reached line is an issue as well. Providers have complained this, that local authorities all took a variety of approaches. Some, it was payment in arrears for extra costs. Some asked for, set up an emergency fund. Others put a 10% across costs. But there's a very mixed picture there. I don't know enough yet about what happened and how long it takes money to get to the front line. Next slide, please. So the pandemic highlight. Well, I think there are kind of four things really that you could draw out from, because it's a complicated story, but I think there are themes you can see. So I think the first thing is the threat of a major emergency, COVID-19, does not mean that long-standing problems suddenly disappear or they can be instantly solved. And I think the major one that we were thinking was the fact that for the last 20 years, governments of all stripes failed to integrate adult social care and health at local level. So that differentiated stick of integration was an immediate barrier to getting things done quickly. The second thing is the speed at which you can mount and affected by a lot of things beyond government here. The main things are international supply chains and just-in-time logistics, and the fact that you do need to have some thought to what might happen in an emergency, things like PPE or how we ramp up test capacity. It is about money. Since 10/11, both local government and the NHS have financial pressure. Say they're under considerably more, but I wouldn't here. Both services have been under financial pressure. That means at a point of crisis, you have less resilience. And the last point I think is really important too. The pace with which government had to respond that we don't know a lot yet. For instance, there was 3.3 billion allocated to the NHS for what they called enhanced discharge, and at the point we reported, we know that only 113 million had been spent of that. That was through CCGs. So there's a lot of the story that's still untold, where that amount of money has gone. Next slide, please. So, going back to the exam question, what does the market need? I think there's a whole variety of things, but I think these are the key ones. First of all, the department at the upper echelons of policy making needs to give adult social care parity of esteem with the NHS. And that means getting on with a plan for adult social care. Whatever is in the white paper needs to come out. But we need to think about a national level having that parity of esteem. We need clarity and certainty. The amount of money that's been fed into local authorities so far has meant that no one has actually fallen off the edge. We haven't seen a Section 114 notice yet, but I do think that in a lot of ways, local authorities are just hanging on. And the spending review that the Chancellor announced earlier this week that's to take place is absolutely cool. And I think too we have to think very carefully about where it is coming from and the increasing reliance that local authorities have on council tax and business rates and sales fees and charges income, which makes the whole finance system that much more vulnerable to shock and sorts. We need a long-term costed plan for the future of social care. That includes proper moves to integration and workforce development. We highlighted a couple of years ago in a report on adult social care workforce the lack of a level for that. So that's all still a critical gap. We need a strategy for much better data on the front line. So it doesn't do in the emergency to have to try and put data systems together in a hurry. The resource there for effective market management locally, but on both sides of the purchaser provider split, if you like, so that a market doesn't manage itself, needs to be resourced within, needs to be able to do that. We also need an understanding of what future demand looks like. It'll vary across the country, so that needs to be done locally and really. And last but not least, solutions for differentiated provider failure, because the issues are different in different places, but there needs to be resources for that as well. That was all I think I wanted to say this morning, so I hope you found it interesting. But one last thing, we have a lot more work coming. We've got another piece of work coming on social care markets and COVID-19, which will work at the moment. Colleagues are looking at the supply of PPE, what we know from the pandemic and what needs to happen forward. There's another piece of work in the office on shielding as well. So we've got a lot coming through. Grateful to ADASS colleagues always being receptive when we do start a new piece of work, and I'm happy to take comments and questions when we get to the Q&A. Thank you very much.